I love that song.
That was from Taikia's playlist.
Yes, that's my favorite morning song. It gets me going.
I love it. I haven't heard it for a while, but
Yeah.
we have it on our delightful tunes playlist for our employees. So I'm enjoying myself.
I figured it would get the mood set this morning.
That's right. It's great to see my old friends. So this is awesome.
Good
And
to
Chris,
see
I was
you.
sending a note to you right when yours popped up, and like,
I know. Great. So good to see you.
You too. There's a lot of things I miss about Ohio. So.
All right, thanks everybody for joining us. Let's get started this morning. So just as a reminder, this webinar is being recorded. We'll post an archive of it through Disability in Ohio website afterwards. We also have a slide deck and another resource handout that you'll receive. Captioning is being provided today. Thanks, Patty. Turn on the feature through the Zoom menu bar option. As an attendee, we ask you to mute your audio during the presentation period when Taikia and I will be asking questions of Rebecca and Patrick. We do have plenty of time available for our interactive Q&A, and we'll ask you to either provide your questions through the chat, or we can open up the mic and have you connect that way as well. If anyone's tweeting out there, add hashtag NDEAM75. If you have questions after the webinar, we'll have our contact information at the end. And with that, it's now my pleasure to introduce Chris Miranda, the Executive Director of Disability in Ohio. Good morning, Chris.
Good morning, Derek. Thank you. Thanks everybody for joining us this morning for our presentation as we are bringing October and NDEAM75 to a close, and as well as keeping the flame of ADA 30 glowing. So what better way to do this than continuing the conversation that we started with Patrick in July with Derek and Taikia. As you all know who Disability in Ohio is, we are an affiliate of the National Organization Disability In, and our mission is really to assist our employers on diversity and inclusion best practices and training and education. So really today, it is with great appreciation to our employers and board members and future members, and also to Ohio Developmental Disabilities Council for their support for this webinar. Our programs really serve as a way to connect you to thought leaders as well as emerging disability inclusion processes. This conversation, it will open you to the possibilities of the future on disability inclusion. And I challenge you today, as I did in July, to listen and check in with yourself to see what is your next, and what is your next for you, your company's future vision on disability inclusion. So as we say with Disability In, are you in? So I'm going to turn it back to Derek of Forward Works to begin our program. Thanks, Derek.
Thank you very much, Chris. So we want to jump right into it. We have an opportunity to talk about disability employment policy and practices and connect this as our second part in the webinar series. As we have on the screen, Chris, Taikia, and I have been working with Patrick and Rebecca Cokley to prepare for our session today, and I'm now pleased to introduce our panelists. First, I will introduce Rebecca Cokley, Director of the Disability Justice Initiative at the Center for American Progress. As Director of the Disability Justice Initiative, Rebecca's work mostly focuses on disability policy. Previously, she served as the Executive Director at the National Council on Disability, after serving in the Obama administration for 4 years, including time as the Diversity and Inclusion Head at the White House. During her career, she has made stronger and deeper connections across civil rights movements. Next, it is my pleasure to introduce Patrick Cokley, Disability Policy Engagement Manager at Anthem. Patrick supports Anthem's engagement and communication issues related to disability and provides guidance on how changes in legislation and policy may affect care for individuals with disabilities. Prior to joining Anthem, Patrick worked at the Department of Labor, where he served as Director of the Workforce Recruitment Program and was an employer policy advisor at the Office for Disability Employment Policy. Patrick also has expertise in
I know, it
emergency
sounds
preparedness,
very
as well as the relationship between diversity issues and disability in the workplace. So with that, is now my pleasure to introduce Tykeia Wright of the Disability in Ohio team and Right Choice Consulting. And Tykeia and I will now co-moderate the questions for Patrick and Rebecca. Tykeia?
Yeah, awesome. Good morning, everyone. I'm excited to be here and co-moderate this session this morning with Derek. So without further ado, let's just really jump into the conversation. I'm excited to come again for our panelists, Patrick and Rebecca. So to start the conversation, Patrick and Rebecca, we've known each other for a number of years, and I personally admired the work that you both have done around advocacy and disability employment. So let's just start the conversation by adding to your bio. What are you both currently working on? What's new, what's fun, what's interesting, what keeps you up at night these days? And I know that that could be a never-ending answer, but just give the audience just a tidbit of what you're currently working on.
There aren't any national
We'll start with
coming
Rebecca.
up in the there aren't any national events coming up in the next 2 weeks that everyone's worried about, are there?
Everything's boring.
I know. I can't think of anything that's happening, say, at the first week in November that could possibly have all of your attention.
So are you going to answer a question?
Oh, of course. Well, I mean, look, I a lot of exciting things obviously going on, and we would be remiss if we didn't say that the upcoming election has a lot of implications for any individual with a disability, and all of us who work in this space are definitely paying attention. 2020 has been exciting to say the least. We've had SCOTUS appointments, we've had national changes in national policy, response to the pandemic. And then on top of all of that, the impending election, which definitely has all of our attention. Tie on top of that, this is the year of the 30th anniversary of the ADA and the 75th anniversary of National Disability Employment Awareness Month. I mean, I think the curse and the Chinese curse and saying of may you live in interesting times has definitely come to bear on a significant amount of our community.
I was just going to say that I'm trying to save our democracy. But
I mean, potato.
Pretty much. So at the Center for American Progress, our work is really focused on fleshing out from a public policy standpoint, how we get to the goals of disability justice. How do we think about the interdependence of movements? How do we build coalitions across marginalized communities? It has been, even just beyond this year, I mean, the last 4 years has really shown that the disability community is the canary in the coal mine. Yeah. Whether it be issues tied to employment policy, attacks on Social Security and Medicaid, the use of Medicaid work requirements, which make disabled folks have to choose between healthcare and a job.
Technology and accommodations in the workplace.
I don't work on that.
Oh, that's true. I work on that.
You work on that. Yeah. I think attacks on healthcare. I mean, we know that healthcare is the #1 issue for the disability community. You can't have jobs, schools, or housing if you don't have healthcare. And really thinking about the future of healthcare and what that looks like for 61 million people with disabilities and over 100 million people with pre-existing conditions. And so I'm really blessed to be in an organization, to have moved from government to an organization where we are fighting back. And that to me really does matter. It's nice at the end of the day to be able to gut check yourself and know that you've done some good.
Yeah. I think the pandemic has also placed a magnifying glass on any issue that has crossed over with the disability community that we've been involved in new ways. I mentioned telework and, sort of presenteeism in the workplace and the use of technology. When I was at ODEP, I remember a serious 10-year struggle to get telework as a tool that could be used universally across the federal government, in the case of snow days or anything like that. And then, you know, fast forward to the pandemic hitting, and we're still advocating for telework. And then almost seemingly overnight, suddenly everyone is aware of telework, of its processes and the tools that are necessary to do so. You know, at the same time, you know, a lot of the workers that are seen as necessary or essential or individuals who have pre-existing conditions that complicate COVID, those are our people. And so we're really still even more so thinking critically. Even personally, you know, it even affects the way obviously schooling is taking place. And so all those discussions about individualized education plans, all those things that Beck and I may not be working on right now, but are working on because our kids have disabilities, you know, that again is coming to bear. So it's really just a big spotlight being shown on, you know, all of the work of the DISCO and why it's important.
Absolutely. So we talk a lot about disability employment, and we know that this is the 75th anniversary of NDEAM, National Disability Employment Awareness Month. So recognizing that there is a 40% employment gap in the nation, along with a large segment of individuals, we know that individuals and organizations are working on creating more employment opportunities for our community. Why do you think the gap still remains?
Oh, gracious. I mean, there are many different reasons for why the employment gap exists. And I think, you know, normally the place we always start with is the general talent pipeline. Oftentimes, if you talk to employers, they'll say, we want to hire individuals with disabilities. We just don't know where they are. And so what I think we're finally seeing is a lot of companies really thinking critically about how they can increase that pipeline and how they can identify disability as a part of the diversity sort of and inclusion work that they're already doing. At Anthem, we have very much, the way we've addressed it is sort of twofold. We've looked at the talent pipeline, but we're also looking internally at our current staff who may have acquired disabilities. So we have a project called the Lex Frieden Internship, which is named, of course, for Lex Frieden, who's the former head of NCD, one of the architects of the Americans with Disabilities Act, and who is the convener of our National Advisory Board. And the point of the Lex Frieden Internship is to identify qualified candidates with disabilities, young people at the undergraduate and graduate level, and basically bring them in for internship and employment opportunities at Anthem. And these opportunities are not sort of like single set. We're not talking like 7Fs. We're talking about broad reaching opportunities across all aspects of our work. So everything from, you know, policy work on our team, managing our call centers, our actuarial teams, like all of the broad sort of work that we have going on. But the point of the internship is also not just the summer experience. Summer experience is a good thing. It's about a 10 to 12 week experience. But the point of it is also is to identify talented people that could come and stay with us long-term at Anthem. And as I tell the interns, it's not all altruism either. We're actually using the interns to sway company culture. So we want these interns to also be stellar examples of individuals with disabilities showing up and doing good work, not only getting a good experience for themselves, but also showing any managers that might be hesitant or didn't know about disability inclusion to be like, oh, that's a tool that I should have in my tool belt.
Right.
Then on top of that, on the other end, we're also doing something called the Self-ID campaign, which is where we are encouraging all of our associates who have disabilities to participate in a process where they sort of check a box and raise their hands and say, I'm a person with a disability. And the point of this is not, you know, just for data, though data is an important piece. The point of it is we are looking to build a culture of inclusion at Anthem. And in doing that, we have to have honest conversations about who is already working with us and being effective. And we want to sort of start creating that process or continue that process where people with disabilities understand that their experience is valued in our workspace and celebrated. And that by being able to say, this is an important part of my identity, they're able to bring their whole selves to work, but then also create a culture where other people who maybe they have a non-apparent or hidden disability, or maybe they've never thought of themselves as having a disability, would also be willing to raise their hand and say, I'm a part of this community. But it really takes a significant and valiant effort on the part of business to do that.
Can I jump in?
Yeah, of course.
You know,
it's a perfect question. No, go ahead.
I think there's a couple of things. I mean, let's just call it what it is. Like, there's still a lot of ableism in the world, and there's still a lot of, I mean, I interviewed for a job a couple of years ago at a progressive women's organization to do health policy. And I made it to the end. I was one of the finalists. I didn't get the job. And when they called me to tell me, they said, "I'm sorry, Rebecca, we really liked you, but hiring someone like you for that role would be too ambitious for our organization." And it felt like a stab in the gut. You know, and so I think that there's still a sense that there are only certain types of jobs, certain models of jobs that disabled people can do, certain levels of visibility that it's okay to have a disabled person, a person with a visible disability in. You know, I think a lot of times we tend, you know, the private sector tends to look to the government for a model. And what we're seeing right now in the federal government is that they're decimating the Schedule A hiring authority in the federal government. And we're seeing more than 2,000 Schedule A employees leave a year on average, which is massive in terms of increasing the unemployment of people with disabilities. I am really excited to see the Lex Frieden internship start. I'm really excited with all of these internship programs. I don't see a lot of conversion from internships to conversion. I think about programs that put, when I was at the White House, we used to talk to people that were Congressional Black Caucus fellows, and how many of them went from doing their CBC fellowship or internship to full-time paid employment. And thinking about comparable programs in the disability space and knowing that only maybe historically 3 people with disabilities went from these internship programs to actually pay jobs on the Hill. And so really thinking about how do we change the mentality around that commitment? Like an internship, creating an internship program is great. How do we move it to an employment program? And the last thing that I'd really say is, I mean, I think thinking about COVID, I mean, the coronavirus is going to result in the biggest boom in the disability population since AIDS and HIV in the 1980s.
Absolutely.
And we saw how much, let's be real, we saw how much discrimination that community faced. And thinking about things that we've already seen in place. I mean, we've already seen bills introduced that would allow employers to ask employees anything they want about their disability. And to waive any ADA protections as it relates to people with coronavirus. And so I think we really need to we need business to own this. We need business to step up and be leaders. We need and we also frankly need broad-based civil rights enforcement. Like, I'm tired of people telling me that they're going to call the ADA. The ADA is not an 800 number. The ADA doesn't send down civil rights ninjas to fight your case. But we need businesses to comply with the law, and we need businesses to see it as part of their like beyond lip service. We need it to be part of their organizational DNA around diversity, equity, and inclusion, not just an add-on. We're not the short bus for your company. Like, we are driving the bus.
I want a disability rights Ronin to do my bidding. But do you think that there's a generational shift also taking place? Like, I remember we were talking about having the first generation of members of Congress that grew up with the ADA. Do you think there's still sort of an issue at the executive level as to why, you know, concepts about disability haven't sort of trickled down yet?
Oh, I definitely think so. You know, I did a bunch of us were sitting around talking about the types of speaking opportunities that we get. And who we tend to get more speaking opportunities from, like where they come from. And for a lot of us, they come from our peer network versus our elder network. Because our peers are much more likely to see, because they've gone to school with people with disabilities. They've worked alongside people with disabilities. Like, to them, it's natural to be inclusive of the disability community. I mean, we had a conversation last night with Congresswoman Presley, and we're talking about how she and Congresswoman Porter represent really the ADA generation of Congress, and what that means for young people with disabilities, watching them talk about living with an autoimmune disease or using their speech coach from high school still to help them prep for major events. And so I think there is really a generational shift, but it also means that we need the C-suite to be more open to that generation.
Working in the corporate space, it's been intriguing also to see that the way that the the trappings or the way that you move up in sort of a corporate environment, the lessons and the trainings that are necessary to sort of move from just sort of your intro level career stage to leadership. I'm not sure that we have, as a disability community, effectively integrated ourselves into those spaces yet. I don't think that, I think the disability competency, access and accommodations may sort of be at the intro level at B schools, you know, or maybe not even that, maybe sort of like a side or an elective class. We need to get that as a main conversation about good management at intro, mid-management, and high-level spaces. And then when you think about like the business community, you know, they use things like you know, project management training or Six Sigma, you know, in order to bolster their skill sets. I've not seen disability be a part of that. And so that's something that really would need to happen on multiple ends. We need the business community to reach towards us. We need to reach towards them to make disability a core part of that. So they understand that if you're a good manager, you have knowledge of inclusion, not that it's an extra piece or something that's tied in.
So this
Thank you for that feedback.
Oh, go ahead, Takia.
No, I just said thank you for that feedback. Go ahead and jump in.
Thank you. Hey, this is great. This is exactly what we were hoping for. And now it's my turn to dig into this theme of leadership that you've started to speak on, both of you. Appreciate the insights there. You know, what are some tactics that you see from leaders today? You know, really that when we speak of innovative leadership and leaders that are truly making cultural shifts, where perhaps this isn't just about disability inclusion, but it's inclusion for all. What are some practices that you would share with us that you notice that are making effective change in all forms of employment?
Sure. You want to run that one first?
Yeah. You know, I think one of the coolest things that we've seen out of the last year from a political standpoint that ties into business is the hiring of disabled people by political campaigns to not do just disability jobs. And it's been a long time coming, but, you know, I want to note that Mayor Buttigieg hired a woman with a disability, a woman named Emily Vorday, to be part of his leadership on the advance team. And so the advance team, for folks that don't know this, are the people that manage all of the logistics around travel for someone in politics or someone in senior leadership, because they have advanced teams in corporate America. And having Emily in that job changed everything. Emily's a wheelchair user. And so like I remember watching Twitter one night, and she had gotten the campaign to a hotel somewhere in the Midwest and offloaded the bus, got everyone in their rooms. She was actually in charge of Mayor Buttigieg's husband, got Chasten in for the night and went to go to her room and realized that she couldn't access the hotel rooms because there were steps and no elevator and no lift or ramp. And so she talked about like, okay, well, I'm just gonna go like sleep on the bus. And that's not what happened, because somebody from the campaign saw that. And so they unloaded the entire bus. They unpacked the hotel and went and got back on the bus and went to another site. And because it was the values of their campaign, but also because an essential worker that they depended on couldn't perform the essential functions of her job because she couldn't access her room. And watching the other campaigns see that and actually modify their practices as a result of that was really amazing. That wasn't something that I really expected to see. But I think one of the benefits of having such a crowded field this last year was that you had candidates that genuinely wanted to learn and were looking to outreach to anyone that wasn't at the table that hadn't been tapped yet. And I think that really fighting for our voices and our engagement. And we want to see business do that.
Yeah. You know, one of the things that we're also seeing in Anthem is being really deliberate about how you make use of your employee resource groups or associate resource groups or business resource groups, whichever you want to call them. And not only making sure that they are safe spaces for any of those groups, you know, be it your disability resource group, you know, your LGBTQ, African American, Asian, Latinx, you know, women, any of those spaces. But one of the things we've been doing in Anthem is also using those groups to provide additional guidance to our inclusion and diversity department. And what's been cool about that has been what it's done is it's created a forum of almost an additional resource group that we didn't have before that's made up of leadership from all of the other ones. So for instance, you know, we did some work to talk about the way that COVID-19 is effectively is affecting our you know, respective populations. But what happened is that we ended up data sharing. So like if I found information that was talking about African Americans with disabilities, well then that worked for disability resource group, but then also was a benefit to the AFAM resource group as well. And so what it's done is it's created this wonderful collaboration that again leads to more effective engagement and a better culture of inclusion, because we're not working in these individual silos. We're sort of, we all have this understanding that if one of us is to get free, we all have to get free. And it's been really exciting to see that sort of engagement, but then also it's been exciting to see leadership not just see us as a space for, you know, employees to sort of vent their spleen or to talk about, you know, specific issues, but also to say, you guys are experts in this area, and to create a forum where that expertise can travel up the chain of command and directly to our leadership, which has been really cool.
Awesome. Thanks for both of the responses there. I mean, we can learn from other sectors. And Rebecca, you're saying keep an eye on people that are doing innovative practices, because you can model after them. And, you know, we do see some large brands doing that, placing people with disabilities in senior functional roles that are having rippling effects. One I've noticed is Microsoft with Brian Stromer working in the marketing and communications area, but there's many others that are doing that too. And to your point, Patrick, I've seen brands rally around the cross movement with the RGs this year, really on the topic of mental wellness, and that this is, you know, a disability segment and, you know, for mental illness, but now everyone's focused on this topic, and other ERGs are partnering with disability ERGs for subject matter expertise. And it's a great cross movement example. So thank you for those. How about the idea, you know, I mentioned Brian, and he is a younger leader. What are your thoughts about how people with disabilities, no matter their age, can be leaders and be positioned in large brands and companies without being looked at as the youth movement or just the ADA generation, but just people as leaders? I'd love to hear your thoughts on this.
I think we've screwed it up. I think I hate the term youth leader. I hate the term emerging leader. I think social movements of all kinds have always been built on the backs of people that were younger. You know, whether it be the Black Lives Matter movement, whether it be, you know, DACA activists fighting for immigration reform, whether it be the ADA generation, which I want to be really clear, the ADA generation is not young. I keep hearing the disability community talk about the ADA generation as being 20-somethings. No, I wrote the definition of the ADA generation for Secretary Arne Duncan when I staffed him. And it's the first generation of Americans with disabilities that were in K-12 education when the ADA was signed. And so they're folks in their 40s. Like, I hate to disappoint people. It's not 20-somethings. It's folks in their 40s. I think anytime we use youth as a qualifier for leadership, we're creating a false dichotomy. We're making it harder for that generation to be taken seriously in professional spaces. I think it's one of those things that, you know, we keep pushing down who we call youth, but then we say 60's the new 30. Well, those 30-year-olds can't move up if the 60-year-olds don't retire. And so I think we really fundamentally need to have a conversation in our businesses, in our corporate spaces, about succession planning. You know, and it's something that makes a lot of people uncomfortable, especially in a time of a recession. People don't want to talk about retirement. People don't want to talk about moving on. We're a capitalist society. We're work driven. But one of the big challenges is, you know, and people always talk about how, well, you know, newer employees, because I'm not going to use the Y word, newer employees come to a company and then they leave after 3 to 5 years. There's no like staying with, there's no brand loyalty. Well, there's no brand loyalty because there's nowhere for folks to go.
Yeah.
There's no pipeline. There's no movement. There's no access to professional development or retention strategy or promotion strategy. And so I think we have to think really hard about moving beyond this notion of framing people in a generational box and instead framing them as leaders.
Yeah. You know, across our space too, I think what we've noticed is that there is a need sort of on both ends. And I agree with Rebecca in that I think we've overemphasized to a certain extent the importance of youth movements in total. And not to say that the youth disability movement isn't important, especially in the workspace. However, you know, it's also important to have an executive that can step forward and talk openly and candidly about a disability, especially as it relates to mental health related disabilities or mental health conditions. And we know that, you know, the data tells us that when you have an executive who has an open and honest conversation about inclusion, it does permeate throughout the company. Now, this isn't one of those cases where if you only have the exec do it, that you'll have a long-standing, you know, disability and inclusion sort of function. Or if you only have youth, you won't have a long-standing disability inclusion function. I think, again, there needs to be a handshake. There needs to be a middle ground. But I agree with Becca in that, you know, it is a little bit unfair to say that, you know, young people who are new to a space will have to be the motivating factor for a full systemic change. We kind of need all people to step in there. And I think that there needs, again, to be a broader push in multiple spaces to make sure that disability is understood not just as a force majeure or a monster under the bed, but rather a natural part of the aging process that affects everyone equally. And when we can sort of get to that space and get disability off that special shelf mindset, then we can actually start seriously addressing, accommodating, and including as many people as possible.
I also just don't think it's fair for young people.
No, it isn't.
Like,
I mean,
to put the expectation that
they have
having come out of the youth movement, I remember hearing from my elders that they expected us to fix everything. Yeah. And it was like, and where are you going?
I mean, you're supposed to use that energy.
How do we actually build intergenerational solidarity? Yeah. You know, so that we're not all in the back room rolling our eyes when we go to somebody's party where we're honoring someone who's done nothing to build a pipeline. Like, I think that there's there is such a huge opportunity, and I think there's also significant leadership vacuums across the generations in the disability space. I can tell you from doing work on executive search in the White House, like the 45 to 60-year-old range, don't know where folks are, like need folks for jobs, don't know where they are. Yeah. But I think we have to be very careful to allow young people to be young employees in their first jobs and to screw up and to learn and to maybe decide they don't like this job and find something else without putting the onus of the success of disability employment solely on them.
Thank you so much for the perspectives, intergenerational discussion and mindset shift, and perhaps as much emphasis on supply side preparation as opposed to just demand side, which doesn't have a lot of discussion often in our country. So with that, I'm going to flip it over to Taikia.
Awesome. So this has been a fantastic conversation this morning. When we talk about leadership strategies has been a part of the conversation. We know that there are assessment tools and evaluations, you know, whether they're for employers, you know, looking at their engagement in the LGBTQ community, or just their diversity inclusion strategies overall. We know that these assessment tools exist, right? So what do you think about the assessment tools and the value that they hold? And then when we think about small businesses, do these assessment tools have any value or any space in the framework of small businesses?
It's an interesting question.
I've done a fair amount of leadership assessments. I mean, I think it's really interesting how many of them don't have disability as a lens.
Yeah.
And don't, or if they do, it's really awkward. Like you can tell it was written by a non-disabled person who is like probably a former special education teacher. Not to dismiss special education teachers, but like, it's like, oh, do you have special needs?
Yeah.
How are those supported in your workplace? Is your boss nice to you? Like, it doesn't talk about microaggressions that disabled people face. It doesn't talk about, they don't often talk about being in a workplace where, let's say you have an executive leader that uses a lot of ableist terminology and like how that actually impacts the company and the environment in which you work. And so I think we're still at a place where they're trying. It's really cute. It's a valiant effort. I'd give them a bronze star for the day. They're not at a gold star yet. And so I think it's also because disabled people aren't at the table helping design those assessments.
Yeah. Or they're also not in the higher enough levels of leadership that they should be involved in those pieces. And those assessments often approach disability as something that happens to a single member of your staff.
Yeah.
That you might have to support or think about, as opposed to being like, disability is going to be a common part of every American workplace in some form. And you, the person who is either managing the assessment or completing the assessment, may also have a disability yourself.
Yeah.
And they don't really speak like that yet. And that's part of that piece, I think, that we were also mentioning earlier about disability thought being integrated into that sort of business level training and engagement. We need to be thinking about disability engagement in our workspaces as an inevitability, a natural part of our workplace, the way we would expect chairs in the conference room or parents or paternity and maternity leave, natural things that go on with the relationships of work.
Paternity and maternity leave.
Maybe
We're the
we
last
should.
country in the world that
Maybe
doesn't
we should
have
paternity
guaranteed
leave.
paid family medical leave. Plug, I wrote a great piece on paid family medical leave yesterday. You guys should all check it out.
Nice.
And why it matters for the disability community. I want to hit on the small business piece because I think that's an area where there's still a lot of important work to be done. I think I continue to run into small businesses that don't realize that there are tax incentives and technical assistance available to make their businesses accessible, whether for employees or for customers. So I think there needs to be a fair amount of work in that space. I don't really have a sense of how valuable those sorts of assessments would be in a small business place. I honestly think any sort of feedback is important regardless of the size of your job. But thinking about like how you maintain a sense of confidentiality and trust if your business is like 3 people, like who your feedback's coming from, or who you're giving feedback to.
I've also been disappointed at the language tied with small business. I mean, small businesses are always about innovation because they have to be. And I've been disappointed that, considering that a lot of positive disability engagement is really about finding solutions, that somehow there's been this whole piece where the language around the innovation of small business has been disconnected from the innovation of serving or engaging people with disabilities. And I kind of want to see that merge back together. A small business is an innovative space that is also inclusive. Not a small business is an innovative space that can't afford people with disabilities. And it's been disappointing that that hasn't happened yet.
Well, and I also think it's important to note that disabled owned small businesses are still at a significant financial disadvantage. They're not eligible for the same types of grants out of SBA or the Minority Business Development Agency because we're actually not qualify to access those loans unless you're a disabled veteran. You know, that's been one of the things that we've been pushing from a public policy standpoint for a long time is a amendment to the Small Business Act to actually increase the inclusion, or to actually allow disabled owned small businesses to be able to access federal financing for their businesses. Because I also think you adapt to what you see.
Yeah.
And if the small business community doesn't see disabled people owning small businesses, doesn't see them showing up to the trade associations or the annual conferences for, you know, home decorators or house flippers or whatever they are, you're not going to think about that. And so really being thoughtful about what a small business agenda that's inclusive of the disability community really needs to look like. It has to go beyond just access to ownership.
Fantastic. Recognizing that disability is inevitable and a natural part of our workforce. That was powerful. All right, thank you both for those wonderful insights, and I'll turn the microphone back over to Derek.
Hey, thanks, Taikia. So somehow we're on schedule here and have had an outstanding exchange so far. Thank you, Rebecca and Patrick. What we want to do now, we got about 15 minutes left. And so I wanted to pause and ask Angie to come in from our team. I know that I saw one question get posted, but Angie, could you bring that up and we'll start an interactive period. I have about 8 questions in my pocket if people don't have questions, but we'll start. Angie, go ahead.
Thank you. Our question comes from Elise Mort, Internal Communications Specialist for Wolpert, and she falls under the Human Resources branch. We've been struggling a bit to push our inclusion and diversity discussions following Executive Order 13950, though it is more explicitly about race and gender. Do you have any recommendations for how to take more action as a company while avoiding non-compliance with the agenda this administration is setting? It feels limiting and disheartening.
You know,
I'm glad you're answering this because my response is burn it down.
That is, yes, that's your default. It's good though. You know, I think that what you can do is you have a couple of opportunities here. And the main one is to engage your internal groups, especially that are tied around race, especially race and gender, to have sort of some of the unique conversations tied around disability in those spaces. We have to remember that disability is not this, one, what's the word, one thing, homogeneous sort of group. And the way that disability is approached or addressed tends to change from space to space. So encouraging, each of those groups, to talk about how the African-American or how the Latinx or how the Asian American community sees disability or engages around disability spaces, and then using that to sort of seed a broader based conversation. That's one option.
I think you actually go about it the opposite way, because I actually know people that are saying like they can't do that. Like that's in violation of the executive order. Mm-hmm. I think you could have subject matter discussions that cross communities. Like you could do something on, is your family being impacted by COVID? Yeah. And like pull together discussions on that. Like, are you struggling with family caregiving issues right now?
Yeah, that's actually a huge way to do it.
Let's pull folks together and have I mean, you can get at so many issues of diversity and inclusion and like.
Yeah. The caregiver discussion actually gives you a nice run at it too.
Caregiving, I mean, mental illness right now, substance misuse. Yeah. Like think about it from like reverse engineer it. Go at it from like a subject matter angle versus a population angle. Like have a discussion on the economics of reparations.
Yeah, and being in HR too, talking about caregiving also then gives you an opportunity to talk about flexible scheduling, to talk about sort of acquired disabilities over time, sort of family engagement, like Becca was saying, mental health and wellness. It's a wonderful way to sort of edge your way into that conversation.
In the Bush administration, in the W. Bush administration, we were told that we could, I was a participant in a federal grant, and we were told that we were not allowed to talk about sexuality and or sex ed and disability. But they did allow us to talk about like healthy friendships and relationships. And so that's how we ended up getting at that. And so really thinking strategically, I mean, maybe even doing an assessment to say like, what are the needs that you're seeing in your communities? And then using that list to iterate a list of discussions or activities based on those subject matters versus doing it based on constituency type. You actually might build more solidarity across your company that way too.
Awesome. Thanks for the answers. Elsie, I posted here. That's a really good idea, Rebecca. Thank you very much. So let's go back to Angie. Angie, do you have any other questions?
No, I haven't seen any other questions come through.
Okay. Here's one for,
wait. Yeah, one just popped in. Is anyone tracking the names or numbers of the Fortune 1000 companies who have active BRGs?
Oh. Huh.
I would think that's a question for disability.
Yeah, that's definitely a disability in question. That's who I would go to first, actually, to say, do you guys have data on who is using or actively using ERGs, BRGs in a corporate space? I know that it's a practice that has been supported in policy for a pretty long time, but that is a wonderful question, and I definitely defer back to disability in for that one.
Yeah, this is Derek. So there's co-chairs of the BRG committee at Disability In, David Casey from CVS, who's their chief diversity officer, and Helena Berger, who was the former head of AAPD. They currently are the co-chairs. So I don't know the answer, Steve, but those are two folks that might be able to research and answer. Another question came in to me privately. Does the cost of health insurance prevent individuals from starting businesses and motivate them to pursue traditional employment? Most of the startups we see are young adults with mom and dad running the business behind the scenes. Any thoughts there?
You know, I mean, do you want to go?
I was going to say, so it's funny, and I don't think there is any decision made by a person with a disability that the first question you ask yourself is, will it have an impact on your health insurance?
Yeah.
And I don't think we think enough about that. I mean, honestly, that's why so many people with disabilities end up working in the federal government, is because of the really, we'll see how long it lasts. The high quality health insurance. You know, I mean, health insurance dictates, I've had friends have to turn down phenomenal job opportunities in another state because there's not Medicaid parity. Like we've seen friends have to choose to go to a college that's not their dream school because of that. And so I do think that they're like, I don't think necessarily the business world always realizes, I think they see the concept of health insurance as a perk that you offer your employees, not as like, this is the thing for disabled people. Like it is the number, you know, I know people that will take a job with a substantial pay cut if they get really good insurance. You know, and so I do think that we haven't thought enough about, I have some fundamental political issues with the fact that we live in a society where your health insurance is tied to your employment. And I don't think that's okay. But I'm still trying to think through how we get beyond that. But I do think it's important to note that states where they have expanded Medicaid, we've actually seen disability employment and specifically disability entrepreneurship increase up to 10% in certain states because people are able to buy into Medicaid through the exchange and still be able to make money. And so I think we can look at that as an example of like when you offer innovation and flexibility, like people with disabilities will take advantage of it and they will start businesses.
So here's a policy strategy for a company. Could be develop your talent pipelines, advance leadership opportunities, and also diversify your suppliers. Find disability-owned operations and bring them into your fold. We've heard this theme a couple times. Perhaps you can't find employment as a person in one channel, but you could the other way. And look at supplier diversity as a strategy. Thanks for that.
Indeed. And, you know, Derek, I recall too, like a couple of years ago, that was one of the main ways that we were celebrating National Disability Employment Awareness Month. There was a huge sort of discussion about companies that were inclusive of disability, then also looking to their vendor pipeline, and making sure that those places that they were contracting with were also inclusive of people with disabilities.
I always think about, there's a conference that we go to pretty regularly, that's called Netroots Nation. And there's a young man there who, for the last 10 years has run the booth that sells custom t-shirts and custom buttons. And they're amazing. Like, I got a Beyonce for President button for like 4 years ago, and I still rock that regularly. Waiting for that campaign to start up. But
I don't want Jay-Z to be.
It was really interesting because it started out like as a kid with a button press, a kid with a disability with a button press. And he now has, like, when we went there last year, I was like, hey, is Max around? And they're like, oh, he's not here today. He's at another conference, but he'll be here in like 2 days. And I was like, well, who are you? And they're like, oh, I'm Max's employee. And Max had reached out to folks through the Disabled Student Center. Max is now in college. Max had reached out to other students at the Disabled Student Center and hired them to like run the shop that week. And when I saw him, I was like, holy buckets, like, this is amazing. And he was like, yeah, you know, he's like, it literally just started as like me having this idea, but now he's like, now I have to figure it. He's like, and now I'm offering insurance to people. You know, but everyone buys their stuff from Max because he'll put anything you want on a t-shirt. And it's awesome. But like thinking through that, like, where do you buy your shirts? Where do you buy shirts from Johnny J, who is a Native American disabled activist and t-shirt designer on Twitter, who has some of the best shirts? Like, do you buy, you know, do you have like Disability Justice's Love bags from Alice Wong? Like, what are you doing to go beyond? Like, I got that bag from the Ford Foundation. Because they were having a NDEAM event last year, and they made sure all of their swag came from disabled-owned businesses.
Thank you for that. Some great advice here. We have choices. We could be more intentional, all of us, in supporting businesses that are disabled-owned and disabled-led. Hey, we're going to run out of time in our hour here. I just want to check back in. Angie, have you seen any other questions?
No, not at this time.
Okay, so let's go to a wrap-up question. And we've covered a lot of topics. You two have actually behaved quite nicely. So I don't know if this happens in all of your discussions, but it's been outstanding.
All of them. It's always like this.
Well, Taiki and I had a conversation. We had a bit of a dream, and you guys helped fulfill it today. We maybe didn't touch on everything, but if you could do just a flash answer, is there a topic or a strategy when we speak to 75 years of awareness through NDEAM and 30 years of the ADA, if we were all to do one or two things this month, this week, that would help move disability inclusion forward, is there a lasting piece of advice that you could each offer?
I was going to say enforcement. I hate awareness. Like, I really don't like awareness. I think awareness is a fluffy term that people use to make themselves feel good. It's easy to be aware. There's no accountability with awareness. I want to actually see enforcement. I want to see disabled folks at all levels of leadership. I want to walk into businesses feeling good that how they treat their customers is how they treat their disabled employees, and vice versa. And that takes enforcement. And like, enforcement is a hard word, I get that, but we don't cover awareness for other diverse communities. Like, we use very concrete terms with other communities. And I feel like it's part of the euphemism bingo with the disability community that it makes non-disabled people feel safe. Awareness feels safe. Awareness feels like a hoodie that you can put on and go outside if it might rain. But like, if it doesn't, you know, it's not a big deal. I want a flak jacket. I want some Kevlar, because that's what this work is like. It takes accountability, it takes follow through, and it takes compliance. And why do we shy away from that when it comes to disabled people? But we respond with like mouths agape and shock and awe when we see a big corporation treat communities of color badly, or LGBT folks badly, or women badly. Like we need to be treated that reckoning could happen in the disability space at any point in time.
Yeah.
Thank you. Outstanding. And Patrick?
You know, I think that we originally thought, you know, when the ADA was being passed, and, you know, as Employ the Handicap Week started, that we could just sort of create, if we created enough conversation, that all of the other communities in the world would sort of come to the disability community. And then at one point we're like, well, maybe we can get ambassadors to go out and bring people in. But I think we need to really start having some hard conversations about folks with multiple identities, and really making, again, the disability conversation a standard across all communities. And it's not necessarily going to be led by us every time. We're not going to necessarily go to the Black community and tell them how to perceive disability, but we should be encouraging them to have that conversation and to continue coming back to the table to discuss it.
Thank you, Patrick, and thank you, Rebecca and Patrick, as leaders and sharing your time with us. We were, for one moment there, happy to also see an intern make their presence on the stairwell behind you, but then the intern went back upstairs. So we know you have a lot going on. 2020 is a year of with a lot in your family, in your work, and for you to take your time today with us is so appreciated.
Thank you.
Yeah, thank you, Taikia. We are almost out of time, so I'm going to turn it back now to Chris Miranda from Disability in Ohio to close this out. Go ahead, Chris.
Thank you. Thank you both. Thank you everyone on this call for being on the call, and especially to our moderators and to Rebecca and Patrick. So really this last hour, we heard a lot of incredible information. The last moment of enforcement and compliance was just really hit me very strongly to what maybe I can do in the work that I do in my organization. So you all heard this. We want to keep that flame of disability inclusion, and I think today it just got a little bit brighter, but it's all up to us to keep it ignited, and by the work that we do, and the conversations that we have, and the people that we talk to, and the leadership, and talking to leadership, and bringing these through a BRG, through whatever means, small business, whoever you are, and the supplier chain, and all of the things that will just continue to move this work forward. So my little bit about the credits, you'll get a Zoom, or no, you'll get a survey. Click the survey, take it for us. We really value your comments, and also if you want the credit, put your name on it for sure. So I don't know, Derek, do you open up that Zoom so we can see each other? Can we end with that so we can raise the roof on thanking all of you for this incredible hour?
That sounds good. If everyone wanted to turn their cameras on, we would take a team snapshot here. So there we go. They're coming on. And thank you again, Rebecca and Patrick. Taikia, we appreciate Angie on our team from Wright State for helping out today. And Candy, you're smiling. We appreciate your dance at the beginning too. All right, we got a few more. Maybe they're going to join us. Patrick's getting his picture in too. All right, here we go at the count of 3. 1, 2, 3. Awesome. Thanks, everybody. And Taikia, closing comment, take us out.
Absolutely. Thank you to everyone for attending this morning. A special thank you goes to Patrick and Rebecca for sharing your insights, and we love the conversation this morning. We have a lot of nuggets to take away and to really think about how can we implement them in our workplaces to move towards greater inclusion of our community of people with disabilities. So thank you all for your time this morning, and have a blessed rest of your day.
Thank you.
All.
Bye-bye.
Bye. Thanks so much.
Talk to you about music.
Well,